Hello, I'm Dr. López here at Olean Dental Studio, and today I want to answer some of the most common questions about oral cancer that our patients have. So, the most important question is, what's oral cancer? Basically, oral cancer is a disease in the mouth, but some of your cells turns into something bad. It's usually something like a lump or a blister or a red or white patch that doesn't go away, doesn't heal, and usually is very painful. What causes oral cancer? Well, most common things that cause oral cancer are tobacco, smoking, that would be number one. Also, alcohol, drinking a lot of alcohol could cause oral cancer. Some virus like HPV, that means human papilloma virus, is associated with that. A lot of exposure to the sun can cause cancer on the lips, and usually there's a genetic component, so there's something that you can inherit from your parents. Something really important to understand is what is the connection between HPV and oral cancer. Well, HPV stands for human papilloma virus, and this is a virus that could cause cancer. Most commonly, a virus that could cause cancer on the throat. What would be the most common early signs of oral cancer that people should be looking out for? Well, it's usually something in the mouth that doesn't heal. Something small. They usually start small, like an ulcer or a blister. It could also look like a white patch or a red patch. Sometimes it can be a lump over there, and sometimes it can be something painful that just doesn't go away. Sometimes oral cancer actually in the very early stages doesn't give any symptoms at all. That's why it's so important to go to the dentist on a regular basis so they can check your mouth. Because sometimes it can give you something, but sometimes you can have it and don't feel a thing. Oral cancer usually doesn't get better, it just stays in there, looking like an ulcer or something like a burn or a white patch or something else. But the most important thing is something that does not go away, doesn't heal by itself. So another important thing is, what are the most common areas where oral cancer appears? Well, number one is the tongue. Is usually the most common place, especially the borders, the side of the tongue. But it's also very common on the back of the throat or on the back of the mouth, on the throat, or the lips. You can also find it on the cheeks or on the roof of the mouth, but those are the most important, most common areas where you can find it. Lump on the gums could be a lot of things. For example, you can have something stuck in there, a piece of fruit, you can have an abscess from a tooth, and yes, some of it could be cancer. But that's why it's so important that as soon as you see something that's not normal, that's out of the ordinary, you go to see your dentist to have it checked. How is oral cancer diagnosed in a visit? Well, we do an exploration of your mouth. We look both your lips, we look inside of the mouth, we look the roof of the mouth, floor of the mouth, meaning underneath your tongue, your throat. But we also check for around the neck, some of the lymph nodes. We look at to see if there's any bumps or any kind of like little balls or something in there that could be an indication that the cancer has spread to your lymph node. And if we see something that's out of the ordinary, the next step is a biopsy, because you clinically, unless it's really advanced, you cannot know exactly what kind of cancer it is, if it's cancer at all. It could be many things. So if we suspect of something that's out of the ordinary, we need to do a biopsy, because you need to look under the microscope to make sure that whatever it is, you know exactly what you're dealing with, if there's cancer or something else. Then what happens if you're diagnosed with cancer? Unfortunately, oral cancer is not something where you can take a pill and it will go away. The treatment for cancer, most of the time, if not all of the time, involves surgery. You have to remove the lesion, you have to remove the cancer from whatever area that is. And sometimes that surgery, where you remove the cancer, is followed by chemotherapy or radiation therapy, or a combination of all of that. How important it is to detect oral cancer in early stages is extremely important. It's life or death situation, because oral cancer, there's a lot of type of oral cancer where if you find them in the very early stages and you can cut all around it and remove the whole thing, the chances of survival are really, really high. The smaller the cancer, the earlier you detect the cancer, the chances of survival are extremely good. On the other hand, if the cancer spread and it gets to the bone, people may end up losing a piece of the jaw, a side of the face, the whole tone, or in some really advanced cases, you may end up losing your whole life. So it's really important that you go to see your dentist. It's not just to have beautiful teeth and all of that. It's also for your life. It's also important that you check and make sure that if there is anything wrong, you detect it when it's really small and easy to fix, versus once it's spread and it becomes a major problem, it could be too late. That's why it's so important. We encourage all of our patients to see the dentist at least twice a year, and at least once a year do these oral cancer screenings. So if we see something, we can detect it when we're ready. So I hope I was able to answer some of the most important or most common questions about oral cancer. If you have any other questions about it, please don't hesitate to reach at our number here at Orient Dental. We're very happy to answer all of your questions. So that's it for today. But if you have any other questions, we'll be more than happy to help you with all of that.